always say that spontaneous awakening trials are more of an art than a science, and this is what I mean by that. There's a very specific protocol that we follow for waking patients up, weaning patients from ventilators, and extubating them. When it comes to a spontaneous awakening trial, let's talk about the protocol version of what you're supposed to do. Protocol tells you to shut off the patient's sedation. So for example, if your patient is on propofol and fentanyl, turn off their propofol, you can leave the fentanyl, and then assess, can your patient go without sedation for 4 hours or more without any of the following? Shut off your patient's sedation and assess. Do they have any anxiety, agitation, pain, a respiratory rate of 35 breaths a minute for at least 5 minutes? Do they desat? Do they have any acute cardiac dysrhythmias? Or 2 or more signs of respiratory distress, tachycardia, bradycardia, use of accessory muscles, abdominal paradox, or diaphoresis. So this is what I mean where the art comes in. Depending on the patient, how much sedation they're on, how long they've been on sedation. Not all patients will tolerate you just shutting their sedation off. Sure, yes, some of them might. Your 90-year-old grandma that's on just like a whiff of propofol, she might tolerate you just shutting that propofol off. But your young patient that has a high tolerance to these medications, that's on multiple sedatives, is not going to be happy if you just shut them all off. In fact, it actually can be quite dangerous for some patients if you just completely shut off all their sedation. It can be dangerous for you as a nurse and for the patient. So instead, what I like to do if I have a patient that's on a lot of sedation, instead of just shutting it off, is I like to gradually wean it over the next hour or two. Your goal is obviously to try to get your patient awake enough to extubate them, but your goal is also to get your patient on the least amount of sedation that they need. So our goal should always be to get our patient on the least amount of sedation possible, if any at all, or a less sedating sedative like Precedex. So that is what I mean when I say that sedation vacations are more of an art than a science. And you will learn very quickly when you are weaning people from sedation, which types of patients, which types of sedatives, the amounts and all that, which situations where you can be a little more aggressive with how quickly you turn down sedation and which situation you need to be a little more gentle and gradual. I have a whole extubating playlist on all the steps from spontaneous awakening trials through extubating. So definitely go check that out if you want a very in-depth step-by-step process of this. And of course, always make sure you are following your hospital's policies whenever it comes to any of this type of stuff.